Greetings everyone, welcome to the classroom of Kunming Preschool Education College. Today we begin Chapter 8, Assessment of Basic Mobility Skills, Part 1. I am your presenter, Tan Yukin. This chapter will focus on two fundamental mobility assessment components. 1. Bed mobility assessment. 2. Bed-to-chair transfer assessment. We begin with the first component, bed mobility assessment. Within the basic mobility assessment framework, we must first define bed positioning and transfer. This refers to the individual's ability to change body positions while in bed, primarily including rolling over, sitting up, and lying down. Specifically, rolling over involves transitioning between supine and lateral positions. Sitting up and lying down refer to transitions between recumbent and seated positions. Assessment focus. The evaluation examines whether the individual can independently complete bed positioning transfers including rolling over, sitting up, and lying down, and the degree of assistance required during these activities. Primary assessment approaches include scenario simulation and structured interviews. The assessment employs a standardized scoring system ranging from 4 complete independence to 0 total dependence. Assessment protocol inquiries. Grandfather or grandmother, can you turn over independently while in bed? Are you able to sit up by yourself when waking? Do you require assistance when lying down to sleep? And what specific support do you receive? Detailed scoring criteria. Score 4 completes all bed transfer movements independently without assistance, may use assistive devices such as bed rails. Score 3 requires verbal guidance or prompts, for example, reminders to bend knees or utilize bed rails when turning. Score 2 needs minimal physical assistance, for example, help bending knees when rolling over. Score 1 requires substantial physical assistance but maintains cooperation, for example, can transition from sitting to lying but needs help moving limbs for other transfers. Score 0 completely dependent on assistance and unable to cooperate, for example, chronic bedridden status with limb weakness, preventing independent movement or cooperation. Critical assessment considerations require particular attention. 1. Positional transfers performed during body cleansing, incontinence, pad changes, or back percussion are included in the assessment scope. 2. Preparation of assistive devices is excluded from the evaluation parameters. 3. The assessment specifically targets activities of daily living. Performance during rehabilitation training is not incorporated into the evaluation. Special circumstances documentation. If the individual can complete transfers with therapist assistance during rehabilitation, but remains completely dependent at home, score 0, and document this circumstance in the special conditions record. We now proceed to the second evaluative component, bed-to-chair transfer assessment. This domain examines the individual's ability to transfer between bed and chair surfaces, including wheelchairs and commodes, encompassing the sequential movements of sitting at bedside, rising, ambulating to the chair, seating oneself, and returning to bed. For wheelchair users, this includes auxiliary actions such as brake engagement and footrest management. Assessment focus capacity for independent completion of the entire transfer sequence and quantitative assistance requirements. The evaluation employs standardized scoring criteria utilizing scenario simulation and interview methodologies. Standardized assessment inquiries include: Grandfather or grandmother, are you able to transfer independently from bed to chair? Might you demonstrate your technique for moving between bed and chair surfaces? Do you require assistance during bed-to-chair transfers? If so, what specific support is provided? Grading criteria 1, score 4, completes bidirectional transfers independently and safely without physical assistance, may use assistive devices, maintains balance without instability or fall risk. Note: independent execution while utilizing support services qualifies for this rating. 2 score 3 requires verbal guidance for task completion, for example, reminders for wheelchair brake activation or footrest positioning. 3 score 2 needs minimal physical assistance, for example, stabilization during seat-to-stand transitions or seating motions. 4 score 1 requires substantial physical support while maintaining cooperation, for example, capable of weight bearing but needs continuous stabilization. 5 score 0 complete dependence without cooperative capacity requiring full lift transfers. Precautions. Assistive device preparation is excluded from evaluation. The assessment of bed-chair transfer ability is aimed at the bed-chair transfer behavior of the assessed subject in daily life. The performance of the assessed subject in bed-chair transfer rehabilitation training is not included in the scope of the assessment of bed-chair transfer ability. Special circumstances documentation. Scenario 1. The person being assessed can use a cane to move between the bed and chair independently during the day, but needs assistance from others to move between the bed and chair when getting up at night to prevent falling. In this case, the assessor may assess the person's ability to move between the bed and chair as 4 points based on their physical and mental condition, and record this situation in detail in the special matters record sheet. Scenario 2. The person being assessed usually needs assistance from others to complete the bed-chair transfer, but when they are energetic, they can complete the bed-chair transfer independently using assistive devices occurring 2 to 3 times a week. In this case, the assessor can assess the person's bed-chair transfer ability as 2 points based on their physical and mental condition, and record this situation in detail in the special matters record sheet. Scenario 3. The person being assessed lives alone and has no one to care for them. They claim that they can safely transfer between the bed and chair on their own. However, during the assessment, it was found that the person loses their balance during the transfer and is at risk of falling if there is no one to supervise them. In this case, the assessor may rate the person's ability to transfer between the bed and chair as 3 points and record the situation in detail in the special matters record sheet. We will now examine a critical thinking exercise requiring application of recently acquired knowledge. Case 1. Mr. Lee, 66 years old, presents with right-sided hemiplegia following cerebral hemorrhage. While family reports he can complete bed-to-chair transfers using a cane, they provide continuous physical support due to safety concerns. Case 2. Mrs. Sheng, 72 years old, demonstrates left-sided mobility impairment. She reports independent transfer capability using a cane during daytime hours, but requires caregiver assistance for nocturnal bathroom visits. As assessing professionals, what scores would you assign for bed-to-chair transfer capacity to Mr. Lee and Mrs. Sheng? Justify your clinical reasoning. This completes our systematic examination of fundamental mobility assessment protocols. We appreciate your scholarly engagement throughout this academic session.